Today, I'll be walking you through exactly how hospice care works and the many benefits of hospice that families often don't discover until they've experienced it firsthand. And oftentimes, it can be a little too late. Hospice is often misunderstood as giving up, when in fact, it's actually about changing the focus from fighting for more time to just ensuring that the time remaining is both meaningful and dignified. I'm Jasmine Bhatti, registered nurse and founder and CEO of Navi Nurses, and we serve the Phoenix and Scottsdale communities. In my work managing complex care transitions, I've seen how understanding the true definition of hospice can transform difficult final chapters into meaningful experiences. Let me explain exactly how hospice care works and the comprehensive and incredible support that it provides. Let's start with a clear hospice definition. Hospice is a specialized approach to care that focuses on comfort and quality of life for people who are facing a life limiting illness, typically with a prognosis of 6 months or less, while providing the emotional and practical support for the person and their families. As nurses, we see hospice care as a shift in care goals rather than as giving up. The core principles related to hospice are treating the person rather than the disease. At this point in time, we're not only addressing the physical and emotional needs, but also the spiritual needs of the person and their family. With hospice, the goal is to affirm life while neither hastening nor postponing death. It's also to support the families during illness, all the way through bereavement, with a team-based approach to comprehensive care. Hospice itself is multidisciplinary. It's made of a group of physicians who still direct your medical care and your symptom management, as well as nurses who come out and visit you regularly in your home for assessments and provide hands-on care. And it also includes home health aides who provide assistance with personal care and daily activities like showering and bathing. And you'll also find social workers who provide emotional support and resource coordination, and chaplains who are available for spiritual care according to the person's beliefs and preferences. Hospice also has volunteers that provide companionship and resources such as music therapy and pet therapy. And there's also bereavement support, which provides counseling for families before and after death. Understanding how hospice care works begins with recognizing that it's a team approach. One of the key benefits of hospice is this comprehensive support system that addresses not just the physical symptoms, but the emotional, social, and spiritual needs as well. There are many services provided through hospice. The first and most obvious is the medical care. We're really seeking to keep pain minimized and symptoms managed. Hospice also provides your equipment and your medications. So things like your hospital beds, oxygen, wheelchairs, everything as you need. The cost of your medications now disappears because the prescriptions related to the terminal diagnosis are also covered by hospice. And there's also 24/7 availability for nurses who are on call for urgent situations. Your hospice team will provide education, emotional support for you and your loved ones, and respite care, which is short-term inpatient stays perhaps, to relieve your family of caregiving burdens. A significant benefit of hospice is that it brings professional care into your home, allowing people to remain in their familiar surroundings and die where they are the most happy. Families often tell us that this provides immense comfort during this difficult time. Getting started with hospice begins with a simple physician certification. This is when two doctors confirm the terminal prognosis of 6 months or less. Then, with your consent, you get to choose hospice care over a curative treatment, perhaps. And once you've agreed to hospice, it can occur in one of two places, either an inpatient facility or in your home. You'll experience an initial evaluation where a team comes together and figures out what is the best plan for you. And part of that plan is deciding, is it going to be at home or is it going to be in a facility? If you choose hospice care that is provided in a facility, typically this is reserved for people who really have perhaps a week or so left before death is imminent. In this situation, hospice care is provided by a team so family can relax and the family and loved ones do not have to provide any of the skilled care at all. However, if you choose the option of hospice care at home, the hospice visits are tailored to the stage of life of where your loved one is at. So visits may only be once a week to start with, but will incrementally change as their condition changes. With this option, you will still have hospice support that comes intermittently to the house, sometimes in hourly increments, and this will change. It will, over time, you'll have more visits and maybe they're a little bit longer, but rarely will you ever have support 24/7 in the house to help provide nursing care and support to your loved one. This is why many people choose to turn to private nursing care during this time period, because nurses are able to come in, provide the medications, and actually collaborate with the medical team who is providing the hospice care to change the medications as we are watching the progression. We want to make sure that your loved one is as comfortable as possible, and only a nurse in the home can actually help direct what medications and what interventions are going to help your loved one die with the most peace and the least amount of suffering. And what I think a lot of family members don't realize is how exhausting providing 24/7 care in the home is to a loved one who is dying and actively dying. This requires someone to be up with your loved one 24/7, and it can be quickly overwhelming and exhausting. But bringing in other supportive services will help you get the rest you need so that during your waking hours, you can spend every magical moment with your loved one and enjoy each other's presence, which is by far the most important gift possible. The other really important thing about this is having a nurse in your home to walk you through will help you and your family understand what's happening every moment along the way. They will help involve you in the process so that when your loved one is perhaps ready to take their last breath, they're going to be able to help tell you and your family, it's time to come in and say goodbye. Understanding how hospice care works includes knowing how to initiate these services. And I'm going to tell you something. Anyone can reach out to hospice and ask for an evaluation. The process begins with the physician certifying that the patient meets the prescribed hospice definition of having a life expectancy of 6 months or less if the disease follows its natural, normal course. The routine for the care that's provided will change and adapt as the needs of the person change. By definition, hospice takes a coordinated care approach where specialists work together to address all the dimensions of suffering. One of the most valuable benefits of hospice is having 24/7 access to professional guidance and support, sometimes preventing unnecessary emergency room visits during crises, or just helping to relieve you or your loved one's anxiety. A key aspect of how hospice care works is its unique payment model. Under Medicare and almost all insurance plans, hospice services are fully covered. This eliminates financial stress during an already challenging time. Hospice provides expert care and support during one of life's most challenging transitions. By focusing on comfort rather than cure, hospice helps people live their final chapter with dignity, meaning, and freedom from unnecessary suffering while supporting their loved ones throughout the journey. So if you're considering hospice for a loved one in Phoenix, Scottsdale, or surrounding areas, Navi Nurses can provide specialized registered nurses who can guide you through how hospice care works. And we can deliver expert hospice services directly in your loved one's home, in addition to what is covered already through your insurance. Our experienced nurses offer compassionate end-of-life care and will help you access all of the benefits available to you. If you or a loved one are exploring hospice, please subscribe to our channel and hit the notification bell for more videos about end-of-life care options and support. If you know others who might be asking themselves, how does hospice care work? Please share this video with them so they can also understand the true definition of hospice and the services it encompasses. Your engagement helps us reach more families during this critical time of need. Thank you.